This is Democracy Now!, democracynow.org, War, Peace, and the Presidency. I'm Amy Goodman. Amidst Israel's continued military attacks on Gaza, the World Health Organization says its mass vaccination campaign against polio has so far reached about a quarter of Gaza's children to protect them from paralysis after Israel agreed to 8-hour pauses in its attacks in certain areas of Gaza. This comes after health officials recently confirmed Gaza's first polio case in a quarter of a century, a 10-month-old child. This is Gaza resident Baha al-Arbid.
We've heard about the truce for polio vaccinations, but I want to stay in this area because I don't trust this truce that has just begun. We still fear bombing will happen at any moment, as it happened this morning.
And this is Ghada Judah, who recently got her children vaccinated at Yafa Hospital in Deir al-Balah, where she's also volunteering with the polio vaccination campaign.
We are displaced from Deir al-Balah. I gave my children the polio vaccine to protect them from disease, but I can't protect them from strikes and from death unless you help us, just as you helped us and delivered the medications to us to protect our children. So please stand with us to stop the war so that our children can live peacefully and to continue their studies.
This comes as residents of Gaza are also facing other diseases and chronic lack of food or access to education. This is Karim Yassin, a 10-year-old Palestinian boy in Deir al-Balah as well.
We want to play with our friends, go to school, eat and drink, but this vaccination is of no use. It's only useful against polio, but the war has destroyed us. It has destroyed our houses. I wish I can play with my friends, go to school. I wish to eat and drink like I used to before.
Just before we went to air today, Democracy Now! Received this update from Tarneem Hamad in central Gaza, who's part of the polio vaccination campaign with medical aid for Palestinians.
We would need at least 95% vaccination coverage during each round of the campaign to prevent the spread of polio and reduce the risk of its reemergence. However, we've been facing many challenges, given the severely disrupted health system, also water system and sanitation systems. Other requirements for a successful campaign delivery include sufficient cash, fuel, and functional telecommunication networks to reach communities with information about the campaign, which has been very difficult for all of our healthcare workers and social mobilizers who are working on the ground. Gaza has been polio-free for the last 25 years, so the re-emergence, which the humanitarian community has warned about for the last 10 months, is another threat to the children in Gaza and also to the neighboring countries. A ceasefire is the only way to ensure public health security in Gaza and also in the region.
For more, we're joined in Washington, D.C. by Yanti Soeripto, President and CEO of Save the Children U.S. Its staff is working from Deir al-Balah Primary Health Care Center, a key vaccination site, working there in Gaza. Welcome to Democracy Now!, Yanti. Can you explain what is happening, how many people you understand have gotten this vaccine, it's children that they're attempting to do?
Thanks, Amy. Yes, our site, our primary healthcare center in Deir al-Balah, is one of the 51 sites where vaccinations are given to children. I've understood that on day one, we were able to vaccinate 1,825 children already, which is encouraging, of course, and our staff are working around the clock to make sure that people understand, that parents understand where they can go to get vaccinations, that those vaccinations are safe, to make sure that children are prepped, and to make sure that healthcare workers are trained in order to do so safely. But of course, we need much more than just a couple of days to be able to give these vaccinations. Also, you heard the cover rate there between 90 and 95%. But you have to give 2 doses of these vaccinations, and they have to be 4 weeks apart. So 1 dose is not enough.
And can you talk about how these vaccines are being administered? Israel's agreed to certain pauses in the bombing. We're reporting about children being vaccinated in this area and children being killed in this area by Israeli bombs. Explain how it all happens and how the vaccines are getting into Gaza right now.
So the vaccines are getting in through the WHO over the road, but I think, look, you laid out so clearly. You can say I have an 8-hour pause in the window in which you can vaccinate these children in these 51 designated sites. But then, I mean, in practice, yeah, children then have to be moved to a particular site. Then sometimes they have to move back to where they were displaced, because most of the people in Gaza are displaced anyway. They're not in their homes. Homes are destroyed. So it's very hard to see. I can imagine, you heard the previous person in Gaza talking how worried they were to actually even travel across the roads that are destroyed to some of these clinics. So there's real practical operational problems with this current pause. It is not a ceasefire at all. It is an 8-hour pause every day. And then again, the vaccine are oral drops, 2 or 3 drops per dose. You have to give them twice with 4 weeks in between. That means you have to track and trace these children as well. They're all displaced. Whatever happens between the intervening 4 weeks between those doses then also impacts how effective your campaign can be.
So according to the World Health Organization, the Israeli military bombardment of Gaza has damaged or destroyed 31 of 36 hospitals in the area.
Right.
Can you talk about the significance of this, and also how polio has reemerged after a quarter of a century in Gaza?
Yeah, it is unbelievable. Look, I was there end of March, and I thought it was unbelievably dire then. And clearly it has gotten much, much worse since, because I was there when people were still congregating in Rafah. And since then, they've been displaced from Rafah in the south of Gaza as well. So, you know, there is very, very limited access to healthcare. We set up that primary healthcare center in Deir el-Balah. If you look at the people who come there every day, over half of them have to walk more than an hour to get even to that site. So that tells you something about the lack of healthcare, adequate healthcare in Gaza right now. And the reemergence of polio doesn't surprise us. Save the Children and many other organizations and doctors have been warning against this for many, many weeks now. If you look at the sanitation, the sanitary conditions there, solid waste is everywhere in the Gaza Strip. There are not enough toilets, there are no showers. This was a situation just waiting to happen.
So you talked about how this is a 2-dose regimen, and they're trying to get, just under 700,000 children to inject them with these vaccines. This never was an issue in the past. But if they are only able to get the first dose, is it ineffective?
That's not the right level of coverage. I think, and we should also remind ourselves, these are oral drops. Children are already in Gaza, are already malnourished. They're weakened. Their immune systems are compromised after almost a year of conflict, displacements, lack of food, you heard it here before, lack of clean water, etc. So to get adequate protection, they would definitely need those 2 doses. So we're concerned that even in the current setup, we will do what we can. The WHO is doing what they can, but it's going to be difficult to reach the coverage numbers in the way that you would normally do it in a campaign.
So surviving families in Gaza have to trust that as the polio vaccination campaign makes its way, for example, to Rafah, and then there's a pause there, that they won't be bombed if they leave their house or wherever they are currently displaced to get this vaccination. That's in Gaza. Meanwhile, tens of thousands of Israelis are continuing their protests, calling for a ceasefire and a hostage deal from the Prime Minister, Benjamin Netanyahu, who has said no so far. The significance of this and the position of Save the Children on a ceasefire.
We've been calling for a ceasefire since October last year, because we know as humanitarian operators that is the only way to get adequate aid, supplies, and services to children and families that need it now. In the current scenario, our amazing staff and volunteers in Gaza are doing what they can at the risk of their own lives. We've lost colleagues and partners over these past months. But it's really difficult to get people to come out, whether they get vaccinated, whether to get food, whether to get some level of mental health support or protection. when bombs are falling and deconfliction, so the safety of your convoys, of sending your own staff on the road with supplies to reach people, is not guaranteed at all.
In a moment, we're going to speak with Gershon Baskin, Middle East Director of the State International Communities Organization, a back-channel negotiator with Hamas in the past. So I wanted to switch gears just for 1 minute, Yanti, to talk about what's happening in the Democratic Republic of Congo. In mid-August, the World Health Organization declared a public health emergency in response to mpox. This is Nzigiri Lakangira, whose child has been suffering from mpox for days in an isolation ward in Kavumu in the eastern DRC.
Since my child got this disease and I brought him here, he only received 1 injection and some pills. The conditions here are very poor. We have no food and people are forbidden to visit us because we have a dangerous disease. We are suffering a lot and feel like we will die of hunger here.
Before we go, Yanti Soeripto, as chair and as president and CEO of Save the Children US, you were just in the DRC. Can you talk about this outbreak of mpox and what people should understand and how difficult it is to get a vaccination right now?
Right, thanks. Yes, I was there in May. I was actually in South Kivu, which is now the epicenter, I think, of this particular outbreak with over 50% of the cases. It is an incredibly contagious disease. It is very dangerous for children. So of the cases, I think 2/3 of the cases affect young children. And we see a pattern here, Amy, whether it's Gaza or the DRC or Sudan for that matter, contagious diseases, whether it's cholera or polio or mpox, wreak havoc on populations that are already vulnerable, that are displaced, and there is no access to proper healthcare, vaccinations, no sanitation. So, and these diseases often cause even more casualties than bombs and bullets. So we're doing what we can. Again, we're working with communities to make sure that they understand how to prevent or reduce the risk of spreading. Simple hygiene, hand washing. Again, clean water is in short supply. People are weakened because there was already a food insecurity crisis. We're trying to ascertain where people can have access to healthcare. But as you heard on the previous segment, it is difficult to get access to medicine, and there are no vaccines in the DRC either.
Yanti Soeripto, we want to thank you for being with us, President and CEO of Save the Children US.